Norepinephrine, also known by the name noradrenaline, it can be released in the central nervous system by the neurons, but oftentimes it is the medulla, the adrenal gland's main part, which produces the norepinephrine when needed by the body. Norepinephrine has two multiple roles as a hormone and a neurotransmitter. As a neurotransmitter, it plays a major role in attentiveness, emotions, sleeping, dreaming, and learning. In the nervous system, norepinephrine helps upon the activation of the body's fight or flight response by boosting the body with an increase of attention and reaction time. The fight or flight response is the body's primitive and automatic response that prepares the body to fight or flee from perceived attack, harm, or threat to one's survival. For example, if one were to walk down a street and come across a bear, the first thing that one would think is the dangerous situation they are in. The bear might turn out to be just taking a little stroll with no harmful intention, but the body has registered the possible threat and the fight or flight response has already kicked in. Norepinephrine is one of the main components that triggers the body to become hyperactive in these sudden stressful situations. This causes an increase in heart rate, dilation of blood vessels, and increased blood pressure. Cortisol is a hormone that is made and released by the adrenal glands. Cortisol is involved in proper glucose metabolism, regulation of blood pressure, blood sugar maintenance, immune function, and more. Cortisol is termed the stress hormone as it is produced in higher levels during stress-related changes in the body, such as the fight or flight response. Small increases of cortisol have some positive effects including a quick burst of energy, improved memory functions, a burst of increased immunity, and lower sensitivity to pain. However, higher and more prolonged levels have been shown to have negative effects such as blood sugar imbalances, higher blood pressure, lowered immunity, and slowed wound healing.
Study of noradrenaline levels and depression. In the year 1972, a researcher named Janowsky had an aim. His aim was to study the effects of decreased noradrenaline on depression. Like everyone or anyone, you must have a method to test out your aim.
Oh, yes.
He gave his participants physostigmine, which lowers the level of noradrenaline in the body. Then came the results. Within minutes of taking the drug, the participants' mood became depressed, and they experienced self-hate and even suicidal thoughts. Conclusion. Depression comes from a disturbance in noradrenaline levels. This study supports drug therapies that work to increase noradrenaline levels in depressed patients.